Welcome to Rwanda Medical Academy. Today's lesson is about understanding the substances that cause hypotension. And we will use the mnemonic crash to help you master and remember well all those substances. Introduction. In cases of drug overdose, understanding the mechanisms of toxicity and appropriate management strategies are crucial for optimizing patient outcomes. Various substances, including clonidine, calcium channel blockers, rodenticides containing arsenic or cyanide, antidepressants, aminophylline, antihypertensives, sedative hypnotics, and opioids, can induce life-threatening complications if ingested in excess. Each substance acts through distinct mechanisms, leading to a range of clinical manifestations, from cardiovascular collapse to respiratory depression. Prompt recognition of overdose, along with supportive care and specific antidotes when available, is essential for effective management. By using the crash mnemonic, let's explore the characteristics and management considerations for each substance in detail. C stands for clonidine and calcium channel blockers. A. Clonidine. Clonidine is a medication primarily used to treat high blood pressure, hypertension, and attention deficit hyperactivity disorder, ADHD. Mechanism. It works by stimulating alpha-2 adrenergic receptors in the brain, leading to decreased sympathetic outflow from the central nervous system, which results in decreased peripheral vascular resistance and reduced heart rate. Clinical manifestations. In cases of overdose, symptoms may include hypotension, bradycardia, lethargy, respiratory depression, and possibly coma. Clinical considerations and management. Treatment involves supportive care, including intravenous fluids for hypotension, vasopressors if needed, and close monitoring of vital signs. In severe cases, gastrointestinal decontamination may be considered, along with activated charcoal administration. Glucagon or intravenous lipid emulsion therapy may be used as antidotes in refractory hypotension. B. Calcium channel blockers. Calcium channel blockers are medications used to treat conditions such as hypertension, angina, and certain arrhythmias. Mechanism. They block calcium entry into cardiac and smooth muscle cells, leading to vasodilation and reduced myocardial contractility and conduction velocity. Clinical manifestations. Overdose can lead to hypotension, bradycardia, atrioventricular blocks, and metabolic acidosis. Severe cases may result in shock, seizures, and cardiac arrest. Clinical considerations and management. Management includes aggressive fluid resuscitation, vasopressors for refractory hypotension, intravenous calcium for calcium channel blocker toxicity, glucagon infusion, high-dose insulin therapy, and extracorporeal support if necessary. R stands for rodenticides, containing arsenic, cyanide. Rodenticides are chemicals used to kill rodents. Mechanism. Arsenic and cyanide-based rodenticides inhibit cellular respiration and energy metabolism, leading to tissue hypoxia and cellular dysfunction. Clinical manifestations. Symptoms vary depending on the specific rodenticide ingested but may include gastrointestinal distress, respiratory distress, seizures, coma, and cardiovascular collapse. Clinical considerations and management. Management involves stabilization of the patient's airway, breathing, and circulation. Decontamination strategies, such as activated charcoal, may be considered if the ingestion is recent. Specific antidotes, such as dimercaprol for arsenic poisoning and hydroxycobalamin for cyanide poisoning, may be administered. Supportive care, including oxygen therapy and cardiovascular support, is essential. A stands for antidepressants, aminophylline, and antihypertensives. These medications include a wide range of drugs used to treat depression, asthma, and hypertension, respectively. Mechanism. Antidepressants primarily affect neurotransmitter levels in the brain, while aminophylline is a bronchodilator and antihypertensives lower blood pressure through various mechanisms. Clinical manifestations. Overdose can result in a variety of symptoms, including tachycardia, hypertension, seizures, altered mental status, and cardiac arrhythmias. Clinical considerations and management. Management involves supportive care, such as airway management, administration of activated charcoal if indicated, and close monitoring of vital signs. Specific antidotes, such as naloxone for opioid overdose or physostigmine for anticholinergic toxicity, may be used as appropriate. Additionally, continuous cardiac monitoring and electrolyte correction are essential in managing these overdoses. S stands for sedative hypnotics. Sedative hypnotics are drugs that induce relaxation, sleepiness, or anesthesia. Mechanism: they enhance the effects of gamma-aminobutyric acid, GABA, an inhibitory neurotransmitter in the central nervous system, leading to sedation and hypnosis. Clinical manifestations: overdose can result in respiratory depression, hypotension, coma, and death. Clinical considerations and management: management includes airway support, ventilation, and administration of flumazenil, a GABA receptor antagonist, in cases of benzodiazepine overdose. Supportive care, including intravenous fluids and vasopressors if necessary, is also essential. H stands for heroin or other opioids. Heroin and other opioids are drugs that act on opioid receptors in the brain to produce analgesia, euphoria, and respiratory depression. Mechanism: they mimic endogenous opioids and bind to opioid receptors, leading to a variety of effects, including pain relief and sedation. Clinical manifestations: overdose can cause respiratory depression, pinpoint pupils, altered mental status, hypotension, and bradycardia. Clinical considerations and management: management involves airway support, naloxone administration for opioid reversal, and close monitoring of vital signs. Intravenous fluids and vasopressors may be required for hypotension. Additionally, supportive care, including oxygen supplementation and cardiac monitoring, is crucial in managing opioid overdose. Conclusion: understanding the diverse array of substances that can lead to overdose and their corresponding clinical manifestations is crucial for healthcare professionals tasked with managing these emergencies. In all cases of overdose, prompt recognition, supportive care, and appropriate antidotal therapy are essential for patient management and outcomes. Additionally, close monitoring and consultation with toxicology specialists may be warranted for complex cases or refractory symptoms. Thank you for learning. Join and save a life with us at Rwanda Medical Academy.